So the chairperson of the chair of this next session on health financing is Honourable Pomaleu, the Chief Secretary. And I'm just going to introduce the panel for this discussion. And as I do, the stage will be set up. So please do come up and take your seat. So in this session, we will hear from Simon Bland, CEO of Global Institute of Disease Elimination. So Simon has over 40 years of international development experience straddling marine and natural resource management, development economics and global health. He joined GLIDE in 2019 after 6 years as director of the UNA's New York office. He began his career as a volunteer with the Voluntary Services Overseas in Papua New Guinea, VSO, then joined the UK's Department of International Development, working in Africa, South and Southeast Asia, and led country programs in Russia, Ukraine, Kenya, and Somalia before covering health and humanitarian institutions in Geneva. Dr. Sandy Lewin, Senior Program Officer, Global Policy and Advocacy at Gates Foundation. Dr. Lewin currently manages a portfolio of malaria grants and implementing programs that align with the Foundation's strategy focused on sustainability and impact. She is also supporting malaria global policy and advocacy as well as other health partnerships, cross-cutting initiatives, and related investment strategies. Joining us on this panel also, we have Martina Pumbo, Suvahahore Manager, Policy Planning and Economics at the National Department of Health. Martina brings her 10 years of experience in health sector system strengthening and strategic policy management and 7 years in clinical services. She has extensive exposure to the health system in Papua New Guinea with a focus on improving strategic planning, resource management, cascading high-level policies to implementation plans, formulation of health sector budgets, and coordination of public investment projects. We also have Dr. Jimmie Rodgers, Secretary to Prime Minister Solomon Islands. Dr. Jimmie is currently Secretary and has been Secretary since 2019 and has also served as the Chair of the Solomon Islands National Provident Fund Board, the country's largest superannuation fund. Dr. Rodgers has joined the National Health and Medical Service in Solomon Islands as a Senior Medical Officer in 1981 and later served concurrently under Secretary of Healthcare and Ministry of Health and Medical Services, and also Chief Medical Officer in Anesthesia in the country's National Referral Hospital. The moderator of this session is Dr. Christoph Benn, who is co-chair of the Board of Directors, Asia Pacific Leaders Malaria Alliance. Dr. Benn has more than 20 years of experience in global health with a special focus on AIDS and infectious diseases. Since 2018, he has served as senior advisor to the Global Fund to fight AIDS, tuberculosis, and malaria. Thank you very much. Can I ask all our panel members to come up to the stage, and Chief Secretary, and just checking, yes, and our moderator, Dr. Benn. As our panel members are coming up, I'm going to invite Dr. Sarthak, who was meant to speak later on in the day, but his presentation, I think, will set the scene of what is happening in the region and just orientate us, and that will lead nicely into this morning's discussion on financing malaria. Thank you very much. I have a bio that I must read. Oh, he's saying no. I think most people know. Yes, no, I think I should. I'll just very briefly while people are taking their seats. Thank you, everyone. Dr. Das is CEO of the Asia Pacific Leaders Malaria Alliance. He has over 25 years of experience as a public health scientist, development practitioner, and global health policy advisor. Prior to joining APLMA, he held appointments at the Harvard T.H. Chan School of Public Health and the Harvard Global Health Institute. Dr. Das holds an AB from Harvard, an MPH from Yale, and a doctorate of public health from the University of North Carolina. Thank you, Dr. Das.
Okay. Thank you, everyone, for your patience, and Honorable Minister, Honorable Chief Secretary, Lady Roslyn, Dr. Saya, Ambassadors, Excellencies, Ministers. The first thing I want to say is it's invest in zero malaria and the time that's already been invested in getting here for so many of you is a deep signal to the commitment to doing this together. And part of why I'm here and part of why the schedule is a bit discombobulated is that some of you may not know that the delegations from some of our countries have been delayed in their arrival. The session that I was supposed to deliver, the ministerial session, got moved to accommodate that shift. And the intention was all along, just so people understand the slight changes here and a bit of what may seem to be confusion, but there is a method to this. We wanted to give a framing of malaria across the Asia Pacific prior to the ministerial session. And another thing about the ministerial session is there are some concrete outcomes of the ministerial session. So the hope had been that would happen first. We're shifted to the afternoon, but it didn't make sense to not get an overview of malaria in Asia Pacific. So I thank all the esteemed panelists for accommodating this. I'll try to be quick, but hopefully it helps set the scene, because the Asia Pacific Leaders Malaria Alliance, as the Director General mentioned, is 22 countries. That's 3 WHO regions, the Eastern Mediterranean, the Southeast Asia region, and the Western Pacific region. So what you're going to see in terms of the presentation is an aggregate of the data across the region and then looking at some of the data within specific areas. So if we can pull up the slides, please. Thank you. While we're pulling up the slides, the other piece that I would like to say, and I think you have the wrong slides, it's not progress and challenges. Yeah. No. No. Okay. In the interest of time, we'll just go with what you have. It's fine. It's actually not the version. So in this region, I think in terms of good news and the not so great news, we've been hearing a lot about this through the video in short. But rather than focusing particularly on Papua New Guinea, because that's where so much of our emphasis will be through much of the summit, I think it would be helpful to share with everyone the formulation of this summit and the concept behind the summit. We see it as a split of 50-30-20. And we've been learning this through our past summits with Bhutan, the royal government of Bhutan, and then the government of India last year, that the governments host these summits, we help to facilitate it, and 50% of these summits should be about the country in which they're in, to help focus attention, re-galvanize the fight in that individual country. So 50% of this summit is really about Papua New Guinea, and by intention and design, the delegations that are here, who are from the country, and I don't want to neglect the travel that many delegations have done within Papua New Guinea, having lived here for many years myself, that's no small feat. 50% of this is for Papua New Guinea, as we discussed with Minister Tom and Secretary Liko and Deputy Secretary Y. 30% of it is to help refocus on the Pacific and Melanesian region, specifically Solomon Islands, Vanuatu, Papua New Guinea, and the eastern part of Indonesia. And the last 20% is to make sure that Asia Pacific as a region, which only accounts for less than 5% of the global burden of malaria, remains on the radar of the global discourse. Now, why is that important? One might say, given the division of the burden of the disease. Well, I think many people in this room who do travel to a lot of international meetings, apart from hearing about Asia Pacific, putting it the other way, there is a lot that Asia Pacific has to share. There is a lot that Asia Pacific has to learn. And the sooner that we can accomplish our goals here, the less we are a draw on resources for the global malaria fight and can help accelerate progress in the rest of the world, namely in sub-Saharan Africa. Thank you very much for this. And now I'm going to go very fast. So I see this remarks as really an opportunity in coming together to reimagine what we are doing. But this is not reimagining without paying attention to the history of where we've been. So if you can go to the next slide, please. How do I do this? Yes. To go back 5 years ago, just play the first slide, please. I don't know if this is working. Yeah. Does this work? Does anyone know? I will let you advance the slides. Thank you. 5 years ago, when the Lancet Commission was released, and I think it's very important to revisit this, was first to drive down disease and deaths and cases to modest levels to prepare for elimination. And the second is to create, in some of these countries, large-scale demonstration projects. I think it's critically important to remember these first 2 points, because what we are faced with in Asia Pacific is this concentration of malaria, as if you can go to the next slide, please. 99% of malaria sits in 7 countries in the region. And in those countries, we're sitting in the country that has the lion's share of malaria in the Western Pacific. And so I would hope that part of what could come out of this convening is an effort to create a very intentional, large-scale demonstration projects. Many of these already exist, but more need to come on board that can help us begin to take the problem down. 2030 is a distant goal. 2027 is certification time. That is even distant. We need to be working together to figure out how we get to the level of a district, how we get to the level of a ward. And we need to advance and move in a systematic manner in that way to actually be able to affect progress, rather than sitting in summits time and time again speaking in extraordinarily macro terms, because that is the only way we'll be able to do this together. Next slide, please. And when we think about that, that is the only way that we're going to course correct for something that is woefully off track. And this is just another way of looking at what I had presented. And Pakistan, most notably, next slide, is a critical part of why this has happened in terms of the doubling of cases that we've seen. We heard about climate change and its impact on the surge of malaria in Pakistan. To the next slide, please. In the good news within this region, an honorable minister is here with us, and we're delighted to have Timor-Leste as part of this. I hope that for those who are not aware of what has been accomplished in that country, it is an incredible task. And our board chair, who's moderating the session, who's also one of my bosses, is the Aploma board chair, signed the first Global Fund grant in Timor-Leste. And to think about where that country has come and what it has accomplished, there is so much to be learned from Timor-Leste. To the next slide, please. In Bhutan, we have 0 indigenous cases reported for the first time. To the next slide, please. And in the Greater Mekong sub-region, to the next slide, for those many who are in this room, and you'll probably hear from Dr. Ratanasai later on this, Cambodia, Laos, and Vietnam, and our colleagues are here from many of those countries, are doing incredible work to reach these targets. To the next slide, please. Thailand is experiencing a rise in cases due to the conflict in Myanmar, and that just tells us that how do we proactively think about what we do across borders to mitigate the effects of these conflicts will be critical as we work towards our goal. To the next slide, please. And one of the other critical points, I think, for us to remember as we gather together, and the Honorable Minister for Health from Indonesia had very much wanted to be here, and we had met with him, and unfortunately there was a conflict with the board meeting with Gavi, and I hope it's okay that I release this information now, that he has already signed the call to action that will be signed later today. So we'll have all the ministers have signed on to the call to action, which will be signed later today. But in Indonesia, to the next slide, as in India, the concentration of malaria that we see is really among specific populations, largely in highly rural and tribal areas. To the next slide, please. So the point about subnational targeting and malaria control, I think most in this room would be familiar with it, but I think the most critical point about this that we have to make sure is that we recognize it goes back to this whole notion of large-scale projects and the ability to accelerate progress in a very specific locale, because that specific locale and the allocation of resources in that locale needs to happen with the government in that locality to enable the progress that we need. To the next slide, please. The only major point that I'd like to make here, and this was made somewhat in the video, and I hope that it's clear, and I'm going to end with this, is a real plea for all of us to recognize how important women are in the fight against malaria. And I say that from the perspective, thinking of it from the perspective of communities, what we do and how we understand and recognize women as the gatekeepers to health, be they as health workers or be they as mothers or be they as young women who have taken on a lot of responsibility to care for families, perhaps ahead of when they should have to. And then also thinking about it in terms of research and making policy. And I will be the first to admit, as I stand here, as we work together with the government, as we worked with many partners to come up with the agenda for this meeting, I really hope in the next summit that the gender imbalance that's present here does not persist. I think we've come a fair bit, but I think we have so far to go, and we have to recognize that without incorporation of women's leadership in the solutions, the 2030 goal is just a mirage, and so we must recognize that. And with that, I'm going to turn it over to you, Chief Secretary, for the financing panel, and thank you all for bearing with all the changes. Thank you.
Thank you, Dr. Das, for giving a pretty good overview of how the region is faring in terms of its effort to eliminate malaria. Out of the many things that I do, part of it is to adjust to the program. Part of it is to work out whether I should stand or sit down. But to give respect to our esteemed panelists this morning, I thought I should deliver my introduction to the session, standing up, and if you could bear with me for a few moments, let me just do that, and then I will turn the floor over to the moderator of this session. So as you saw in the slide presentation just then, the Asia Pacific region has made substantial progress in malaria elimination. But there is a surge, 1.76 million in 2022, the cases compared to 21, doubling in number for the first time in a decade. We are off track. We are off track in terms of the 2030 elimination goals. Speaking specifically for Papua New Guinea, we've seen 857.3% increase in cases since 2010, from the number of 93,956 in 2010 to what is now sitting at just around 900,000 cases in 2022, and that accounts for 90% of malaria cases in the Western Pacific region and 23.8% of all cases in the Asia Pacific region. So malaria continues to remain at the top 10 causes of death for Papua New Guinea at the present time. And while we are observing those trends, we are also experiencing an unfortunate decline in financing for malaria, which obviously compounds the challenges of rising cases, escalating costs, and competing domestic crises. And the worrying thing, of course, is that if this gap in financing is left unfilled, then it will obviously threaten the hard-won gains in elimination. And based on analysis by the Global Fund request, the financing gap for the Asia Pacific stands at an estimated $339 million US post-2026. And therefore, filling the widening malaria funding gap will require more than just an incremental attention and investment from existing sources. So we're going to have to talk about innovative financing mechanisms, the ability to pool funding from different sources, different channels, is a critical conversation. Possibly blending financing using catalytic capital from public and philanthropic sources, or increasing private sector investment in sustainable development. We have to work with a very, very open mind. Another strategy perhaps is to direct increased investments towards integrating malaria elimination efforts with broader public health programs. For instance, many countries have worked to integrate malaria and other vector-borne diseases and neglected tropical diseases. Some are jointly managing malaria efforts with primary healthcare efforts and other non-communicable diseases. I understand APLMA and the Global Institute for Disease Elimination are currently supporting an integrated disease surveillance project for malaria and lymphatic filariasis in Malin Bay. And those initiatives tend to bring more improved utilization of existing resources and more coordinated efforts to sustainably improve outcomes for all our multiple diseases. We have a panel of esteemed speakers that bring with them perspectives from Africa, international foundations and multilateral development banks. And this session is about innovative health financing, which would focus on amplifying the urgent need for additional resource mobilization and to focus on the strategies that could be considered to increase investments for malaria elimination. Our session moderator is Dr. Christoph Benn, board chair of APLMA and director of Global Health Diplomacy, Job Longy Institute. He brings with him a wealth of more than 20 years of experience in global health and was a member of the Global Fund's board at its foundation in 2002. He then spent 15 years as the fund's director of external relations, where he oversaw key fundraising initiatives as Product, Red Deb T2 Health, and under his leadership, the Global Fund raised more than 50 billion. That's a significant effort that has no doubt changed the course of HIV, TB, and malaria programs across the world. We have in the room an esteemed guest with experience that we should all be looking forward to hearing. Dr. Benn, I turn the floor over to you.
Thank you very much, Honorable Chief Secretary, for this very kind introduction. I'm really looking forward to moderating this panel of exceptional people that you will hear from in a minute. But before we go into our panel discussion, there is a presentation from one of the panelists, Dr. Jimmie Rodgers, already introduced to you and well known in this region. He will set the scene with a couple of slides, and then we will move immediately into our discussion. So over to you, Jimmie.
Thank you, Chief Secretary. Since I'm sort of the first of the people coming in to speak, may I, first of all, on behalf of all of us, convey a sincere thanks to the government of the independent state of Papua New Guinea, and also to APLMA for bringing us all here, at this 8th summit. I think it's wonderful to have the first one in the Pacific, and only Papua New Guinea can do it. I think we started off this morning, I thought was very, very good. We did an invocation to seek God's guidance. We uplifted the country through the voices of the young people and the welcome from the traditional communities. And then, of course, we ended that with a slide show that showed us where we are. And thank you, APLMA CEO, for emphasizing some of that. And yes, the Chief Secretary has already spoken quite a bit of some of the stuff that I was going to share with you, so mine should be reasonably short. So let me just have a look at the slide, and yes, can I have the next slide, please? So I'll just talk on 3 points. The first one being the landscape of Asia Pacific financing, and then a quick focus into the Pacific, and probably just look at some of the key constraints and opportunities. And I'll be repeating a number of the messages that the Chief Secretary has said, but I think it's worth repeating some of those because they're that important. Next slide. Okay, so we've already heard about the decrease in global fund resources. And probably global fund was probably the salvation in a way for fighting 3 diseases. I'm happy to be the first one in the region to help facilitate the very first regional grant that came into the region. Next slide. Okay, so although the allocation for malaria has gone up slightly, the allocation for the Asia-Pacific region has actually gone down, roughly by 103 million. And the next slide. Okay, so the next slide, carry on, please. Keep going. So we went from 12% to 9% of the total allocation of malaria. Next slide. Okay, so when we look at the total gap, and this slide has already come up, you're looking at this 478 million as the total gap to the financing resources needed for this whole region to overcome malaria. And the 103 million shortfall by Global Fund is actually sort of worsening that gap. Most of the gap is at domestic level. And this graph just shows that every country have allocated domestic resources, some more than others. Every country has benefited from Global Fund resourcing. Some countries have other development partners come in, but every country has a gap. And I think the subject of this session is really to see how we can try and come up with innovative ideas to try and remove the yellow marks. Because if the yellow bars are gone, then that means that this region will actually have adequate resources financially to fight malaria. Next slide. So in the Melanesian sub-region, there are 3 countries, and Vanuatu, quite nicely, is not there because I think they're the closest to having adequate resources through Global Fund and domestic resource allocation to be able to control, eliminate, and hopefully join the list of early eradication as the first candidate from the Pacific. Solomon Islands and Papua New Guinea have a bigger struggle, roughly about 26-27% gap in financing. And I think some of the discussions here will actually be, for us, innovative in how we try to address that financial gap. Next slide. So one of the things, and this is my last slide, and my second last slide, some of the things that we already know on the key barriers. Why is it that some countries are facing difficulties? And we've heard about the Pakistan scenario, the floods. Some of these things are beyond our control. And therefore, we are subject to Mother Nature on what it does, but we have to respond to try and bring malaria down. But with persistent economic challenges, every single country, including one I come from, Solomon Islands, we're sort of living a foot to mouth in trying to make sure that we finance services. So there's always competition for resources. The changing priorities then means that governments have to allocate resources where they think is the most important to address, and sometimes malaria doesn't feature on that. And I think this is why it's quite important. If we look at the Solomon Island figures from 1960, we went to pre-elimination in the early 70s. We were right down to below 18 per thousand. Now we are right up the top. And each increase was related to resource withdrawal, human resources withdrawal. Now, limited trained human capacity, much more problematic in small island states, where 2 or 3 people do a lot more things, and therefore our attention is usually divided. I'm saying this because if to eradicate malaria, we've got to focus, we've got to dedicate attention, and our governments need to then have a look at saying, what is the best way to do this? And we already heard about climate change and its impacts. I don't need to sort of go into those areas. Now, one point I'd like to make is we're talking about innovative financing. But I think in countries like mine, we also got to talk about innovative way of doing business. And really, innovative financing is the one that gives us the tool. But unless people in that country, through a whole of government, whole of society, mechanism where everyone believes that they have a role to play, the increased resources might still not help us eliminate. So I really just want to emphasize the fact that in all countries, we really need to go beyond the health. We can be quite health-centric, and we'll be looking at this from a health lens, but eradicating malaria in some countries that have been successful, they actually involve the whole of society lens. And I think that's probably one of the way of, we need to look at the way we do business in order to do that. So innovative financing that we'll speak on. Our moderator will speak on the taxonomy, on the various modalities that are there at the moment. Each member of the panel will speak on certain aspects of it, and I'll come back and share a few thoughts on some of the things that we are looking at to be possible, including in the Melanesian sub-region. Looking at how we actually pull in funding for climate change, adaptation, and probably most importantly, that integrated vector-borne management is not just within health. There's a tendency to verticalize these programs even within a ministry or department. But I think that approach really needs to go across to the other ministries. And I'll speak a little bit more about that and how we might do it in a small island Pacific setting when I come back at the panel. So with that, thank you very much.
Thank you so much, Jimmie, for this brilliant introduction. So by now you've already got the picture of progress made in this region. Many countries already, a number of countries already eliminating malaria, making great progress. We heard about Timor-Leste, being close, getting close to that. But also we heard about the challenges. In a number of regions, increasing caseload, challenge of climate change that will make the elimination of malaria more difficult. In the afternoon, we'll also hear about new tools that are there that can accelerate clearly the elimination agenda, but all of this will need money. And that's what we are going to discuss here. And we know that, the usual sources of money, domestic budgets are under huge pressure these days. The Global Fund, although it had a very successful replenishment in 2022, already under the leadership of Lady Ross, is looking at a challenging replenishment next year in 2025. So, a lot of the usual sources are under significant pressure. And now we will consider what can be done about that. And when there is a lack of money, then for many decades I've heard already, well, let's turn to innovative finance. That sounds very good, but often it's a little bit of a mystery what that actually means. I have one slide, if you can project that, on the taxonomy of innovative finance. And if we can't show it, then it's okay as well. Here it is. Because I often feel in these discussions that I have around the world on innovative finance, many people mean very different things when they talk about innovative finance. So I thought, let's get a little bit of clarity into that. And I prepared this taxonomy together with my colleague Patrick Silborn, with whom I worked in the Global Fund, but also who used to work at Appelma. And it shows you a little bit the different elements that we will talk about in the coming minutes. And it moves from, mechanisms, voluntary contributions to philanthropic foundations, to consumer-based funding, then to conditional funding, catalytic funding, blended finance. And it has it's a sequence from no-cost recovery, simple kind of contributions to a global cause, to break even and even financial returns. If you go into concessional loans, blended finance, impact bonds and so on, then you will have an increasing element of not only investment but also the expectation of returns. And then you have the earmarked taxes. And we will talk about that in the next couple of minutes as well. There is an airline levy that finances Unitate and other organizations. And there are a number of taxes being discussed these days that can be leveraged to support global public goods and also health issues. If you look at the whole list here, I would say currently at the international level, one element and one mechanism stands out a little bit, and that are debt swaps. You see that in the second column on conditional funding, because it has been promoted particularly by the Brazilian G20 presidency and by the G20 Joint Health and Finance Task Force. There was recently a big meeting in Brazil where debt swaps for health were top of the agenda and being discussed among the G20 countries. And very simply put, it is that there's a lot of outstanding debt in the world. And many countries are suffering, actually, from a huge debt burden that further restricts their fiscal space for health and other social issues. But there is this kind of mechanism where creditor countries can forgive or cancel part of their loans under the condition that these resources will be turned into domestic resources for health. And that is quite promising for malaria. I would say also more broadly for financing climate and health, because I think what we are discussing here is not just malaria as one disease. We are talking also about how can we address the increasing burden of climate change and health that will require billions and hundreds of billions of dollars of investment. Debt conversion could be one element, if used well, that can then finance some of the initiatives that we are going to discuss here also on our panel. So I just wanted to get a little bit of more clarity into what we are discussing here, and you will hear some examples, in the course of our discussion. So with that, let me turn to our first speaker, and that is Sandy Lewin, sitting here on my left. Sandy, you have a huge experience. You've worked for the World Bank. We've worked together for many years at the Global Fund. Now you're with the Bill and Melinda Gates Foundation, or rather the Gates Foundation, as we call it now. So you have this unique perspective of, global financing landscape, and we know there are lots of changes also happening in terms of the global health financing architecture. Could you give us a brief overview of where you see us, in financing malaria, but also other global health challenges?
Hello? No.
If not, mine seem to work.
Thank you. Thank you, Christoph. And good morning, everybody. I think the future of global health financing is really poised to undergo a transformative shift within the context of shifting funding priorities, and also within the context of tight fiscal space and expected reduced donor financing. So this shift obviously will require government, international organizations, private sector, and other partners to collaborate more closely, pooling resources and expertise to explore new sources of funding, and perhaps leveraging also on technological advances and promote multi-sectorial collaboration to meet our health challenges. Just let me mention a few areas. I think other panelists have mentioned this as well. So one area is around domestic resource mobilization. It's not new, but the need to prioritize health spending within the national budget, implementing progressive taxation policies, improving health systems performance, community engagement, and innovation. And we'll learn more about this from our colleague a few minutes later. You've heard about traditional innovative financing mechanisms, and such as the social and development impact bonds, sin taxes, health insurance schemes, blended financing, and other public-private partnerships that can contribute and continue to play a crucial role for health while leveraging private sector resources and expertise. Christoph mentioned earlier about debt to health now becoming more visible as a financial instrument. It's been in G20 discussions. New donors such as China has an interest in debt swaps. So these mechanisms offer opportunities to pool risks, improve cost effectiveness, incentivize investments. The other area is also around achieving synergies on global health architecture. Many of you may have heard about the Lusaka agenda, where global health initiatives are asked to find efficiencies with an urgent call for prioritization to avert potential program disruptions at country level. So global health partners such as Global Fund and Gavi are now working together for joint replenishment, collaborating more to find efficiencies, and then whether this is in alignment on investment cases or common messaging framework. The other area that Christoph mentioned in the taxonomy is volunteer contribution. So philanthropic giving, I think that will be a continued trend. The global philanthropic giving for 2023 was 70 billion. That's contribution from 47 countries, and that includes health-related funding. From the Gates Foundation side, for 2023, the foundation has supported 7.7 billion for priority areas such as health, education, research, and innovation. The total giving to date through 2023 is 59.6 billion. If we look at Asia Pacific region, philanthropic giving is also very interesting. The region is expected to account for over 30% of the 84 million millionaires and 28% of the 340,000 ultra-high net individuals globally in 2025. And you will see in the next 3 decades, an estimated $3 trillion US will be in the hands of a new generation in the region. So these are all new monies that I think our public health community has not really taken advantage of or utilized. Of course, another big area that's been mentioned is climate and health funding. The global community is now responding to climate-driven health crises, and of course, multilateral institutions such as the World Bank and ADB, as well as private sector and philanthropy, will play an increasingly important role. The World Bank has pledged to increase financing to $100 billion annually by 2025. At the end of last year, World Bank announced increased spending on climate, devoting 45% of all new financing to climate-related projects for fiscal year 2024. This is an increase from $9 billion to $40 billion in new lending. ADB similarly has raised its climate finance ambition to $100 billion from 2019 to 2030. Of this amount, $34 billion is targeted for climate adaptation and resilience. They are also working to crowd in an additional 18 to 30 billion in private sector climate finance. So these initiatives are part of the broader commitment to Paris Agreement and to address increasing health risks associated with climate change. The World Bank has estimated that 21 million additional people could die by 2050 from 5 climate-driven health risks. And these are namely malaria, dengue, diarrhea, stunting, and extreme heat. The World Bank has also recently signed an MOU with the Global Fund to strengthen health system, address climate-driven health risks, and advocate for increased funding. But of course, we would have challenges on how we would align these global health architecture in terms of funding cycles and also operationalization of these mechanisms at country level. But these funding, you could use it for climate-smart, climate-resilient health systems, deployment of telemedicine, e-health solutions to reach remote, hard-to-reach populations, or implement early warning system for climate-related threats and capacity-building initiatives. Philanthropy and private sector also interested in climate investment. In 2023, funding for Asia Pacific region from global philanthropy include climate and nature solutions. That was $3.7 billion just for last year. So I think the last thing I'd like to mention is a related topic on climate and health, is to find pathways through impact investors for initiatives such as Blue Carbon Initiative, which is a global program that focuses on conservation and restoration of coastal ecosystems. There is an increasing interest in blue carbon, potentially $10 billion or more, from corporate sector and impact investors, which should serve as a longer-term sustainable financing platform for programs with a focus on livelihood and communities within this ecosystem. So let me close by saying that I think the future of global health financing will require a paradigm shift in our thinking and approach to health financing in terms of having more integration, less siloed programs, building resilient health systems, diversification of funding sources, investing in technology and innovation, looking forward to sustainability and enhancing global cooperation. Thank you very much.
Thank you so much, Sandy. That was a very powerful message. And actually, I want all of us to leave the room a little bit later with the realization that financing malaria elimination is a big challenge. But I want us to leave with a sense of hope. There is a lot of money out there. The question is how we can mobilize that and how we can make it to use for malaria elimination and strengthening health systems and addressing health and climate change. And you've already given us a lot of big numbers, actually, from that is available through philanthropies, high net worth individuals, multi-development banks. The numbers are there. So the challenge will be, how can we make that, effectively available for malaria elimination? Now we turn from the global level to the national level, and it is my great pleasure to invite Martina Pombo Suvehohora from the Ministry of Health here in Papua New Guinea. We had a wonderful discussion yesterday, and you told me about some brilliant ideas that you're contemplating here. So I would like you to address us and tell us a little bit about, what you are considering, what you're thinking about in the ministry here to finance health and malaria elimination as part of that. Thank you. Welcome, Martina.
Thank you, Christoph, and good morning to you all. Good morning to our distinguished guest, Minister for Health, Secretary for Health. So in the PNG context, PNG, we went through economic uncertainty. By 2015, the government started taking austerity measures to control the budget deficit. So we started having budget cuts in our spending. And so from 2015 onwards, we've been trying to incrementally build back our budget since 2015. But while we are trying to build back that budget, we are faced with emerging new diseases, population growth, and so health resource needs increases, and it's still increasing. So that kind of emphasized the needs for the health sector to look into revenue exploring options. So in our current National Health Plan, that is now a priority for us. We have already developed in draft health financing strategy, and we hope to implement some of that. Some are already explored and implement in the phases of implementation, and some we still need more research on. So to take you through some of that, apart from our internal controls where the sector can have control of, from our efficiency spending to capacity building and financial management, to prioritization when it comes to comparing burdens of diseases. These are some things that we are also unearthing at the moment. But when it comes to innovative financing, and Christoph, I will name some of them, but I don't know whether, according to you, there'll be innovative financing, but
I'm pretty sure they are.
We are doing some.
Yes.
And so, first and foremost, we have the tobacco legislation 2016, and that is looking at the tobacco taxation increase. And from that legislation, we would like to establish a health promotion fund. So through that health promotion fund, we will look at collecting the fees and license fees and penalty fees if consumers and retailers breach our regulations and legislations. And that's one that is progressing well. We are now in consultation with the Department of Treasury to establish that trust fund. Another option is the Health Endowment Fund. That has been a concept and also a government vision in our Vision 2050. But that is something that we still need to explore further, what endowment fund really is, and whether our current legislative framework will allow for us to establish such a trust, and also who funds it, who manages it, and how we would implement it. So that is something that we will be exploring further. We also have, in the country, we have about 67% of the population as informal sectors. So social insurance is not feasible and practical at the moment. If we do introduce social insurance, we would have the government increase more funding into health. But we do have a survey done a couple of years, I think 5 to 7 years back, on community insurance schemes that was trialed in West New Britain. Sorry, forgive me, it wasn't trialed, it was a survey that was conducted. And there are some good prospects that we could look at introducing that. But at the meantime, we don't have the administrative and technical capacity. It's quite limited in these areas. But if we build on that, that could look, it could be something prospective for health. We also have recently the Impact Health Project by World Bank. And with that, we are looking into performance-based financing. We've started implementing that in 2020, a bit of disruption with COVID-19, but we are progressing well. But it's at an early stage, but that is also a good prospect for us to look into. We used to have a lottery against malaria. We used to really support the malaria program, but that has declined over the years. I think because they started receiving some grants direct from Global Fund. But if we can pick that up again and strengthen that, would be also another financing option for Papua New Guinea. Thank you, but those are some strategies that we are working on and we're looking into.
Thank you so much, Martina. Really well-deserved applause, because I have to say I feel really inspired by what I heard, from you yesterday and also today. And congratulations also, Honorable Minister Tom, for what you're already putting in place in terms of innovative finance, hearing about the Health Promotion Fund, Endowment Fund. Many of these considerations are absolutely innovative, exactly in line with what has been discussed on innovative finance schemes. So really congratulations to PNG. I think this is very encouraging. Just one comment, I'm also a member of the advisory committee of the Lancet Commission on Investing in Health, and there will be a new report coming out shortly from the Lancet Commission. And the Commission will identify one investment that stands out for all countries, and that's the increase in tobacco tax, because it has really the potential to mobilize significant resources, basically in every country around the world. And it has the double effect that it has a very positive effect on health of the people. So there are very few policies that can be adopted that would have the same effect of mobilizing additional innovative resources and having a positive effect on health, like increase of tobacco tax. So this could really be an interesting source of funding for your Health Promotion Fund and for many other activities. So, very encouraging to hear. So with that, I would like to turn to you, Simon. Simon Blunt, as you have heard, the CEO of the Global Institute for Disease Elimination. But Simon, we've also worked together for many, many years in many different functions, including the Global Fund, fighting AIDS, tuberculosis, malaria. But now you're looking at a number of other diseases that are maybe not as prominent as AIDS, tuberculosis, malaria, but also very, very important. And I would like to hear a little bit from you more about the potential for integrating, all these disease efforts. What are the synergies? How can we improve effectiveness? How can we get more, for the money that we are looking to mobilize? You have tremendous experience with that. Wonderful to have you here, and over to you, Simon.
Thank you, Christoph. It's great to see you again. And just to begin by thanking Appelman, the government of Papua New Guinea, for inviting us all here. It's a rare privilege for me to come back to this beautiful country, 40 years since I was last here. Unfortunately, I'm only here for a few days, but it won't be my last visit. But it's wonderful to be back here. As we think about money, and there is a lot of money out there, but it's difficult to get that money. And I remember being at malaria conversations 2 decades ago in New York with very rich people saying, we know the people, we know where the money is, but actually releasing that money consistently and in a sustained manner is difficult. And all health systems everywhere, in every country, high income, middle income country, low income, are stressed and strained and never have enough resources to do everything they want. So there are always going to be challenges and decisions one has to take about how to use the money. So we must chase the money, we must have more money for health, but there is that old saying of let's get more money for health, but let's get more health for the money. So how do we think about not only innovative finance, but as Jimmie said, finance for innovations. Innovations that help us work in different ways, innovations that help us deliver successes, because success breeds success. and money likes to follow success. So it's really important, I think, to have financing for innovations. So if we think about this challenge of integration, and I think, Christoph, you talked about innovative finance, and it means different things to different people. Integration can mean all sorts of things to different people. Who's being integrated into who? You know, what are we diluting? What are we giving up to do this? And there are all sorts of emotive challenges around that word of integration. But there are some examples of where it might make sense. There are also lots of examples where it doesn't make sense. And if we're thinking about elimination and we care about elimination, I can't think of a horizontal system, a purely horizontal integrated system that has ever eliminated a disease. You always need to have some time and focus to deliver specifics. But it doesn't have to always be like that. So sometimes silos are really important. You know, Midwestern farmers in the US need silos. They do an important job. So understanding where we may work synergistically and where we can't is also important in this dimension, I think. So we focus on elimination. We know eradication is possible. We've eradicated one human disease, smallpox. We've eradicated one cattle disease, rinderpest. We are so close on guinea worm disease, 3.5 million cases down to 14, really close. We're close on wild polio. Circulating vaccine-derived polio is a different story, but we are close. And we have successes in elimination. 44 countries have eliminated malaria, several more on the list. We've talked about Timor-Leste, Dominican Republic as well. And 50 countries have eliminated at least one NTD. That's halfway towards the 2030 roadmap indicators for neglected diseases. So there are successes. Shrinking that map is possible. So where might we find areas of synergy? Where might we find areas of coordination, of cooperation and collaboration? Well, let me talk about lymphatic filariasis, Mr. Secretary. You mentioned it. We're working with APLMA and the Provincial Authority in Milne Bay to think about integrated vector surveillance. So we think about lymphatic filariasis, malaria, and dengue, common vector. We think about lymphatic filariasis and scabies and soil-transmitted helminths, common drugs. We think about lymphatic filariasis and yaws and trachoma, common delivery platforms. Now, a few years ago when I started this job, I didn't know what lymphatic filariasis was, or onchocerciasis, or trachoma, or soil-transmitted helminths. And they don't kill like malaria, but they debilitate, they lose productivity, they carry with them large amounts of stigma, and are real opportunities for tackling the 1.7 million people that are still infected by one of these diseases. So 3 examples there of where LF could be synchronized, synergized with other investments. So in addition to our work with APLMA in Milne Bay, we're working with ALMA, the Africa Leaders Malaria Alliance, on their scorecards for malaria and integrating indicators on NTDs there. We're working with the Philippines on LF and malaria integration. We did some really interesting work in Ghana and Zanzibar, bringing malaria program managers and NTD program managers together and taking them through a structured workshop where they figured out potential areas of collaboration. But they were equally encouraged to identify areas where it just did not make sense. Because if it didn't make sense for the programs together, it just didn't make sense and it wasn't going to happen. But we now have some real champions in Ghana and Zanzibar who are really keen on finding those positive solutions, but also really keen to say that if this just means adding on another thing for a community health worker to do, it isn't going to work. So really looking for practical solutions on how they may work together. Finally, I really pick up on your point, Sarthak. You said 50, 30, 20, and I think that was PNG, Melanesia, and broader region. If I could do 50, 30, 15, and 5 for Papua New Guinea, please. So, and the 5 is global. So here in Papua New Guinea, there is a lot of lymphatic filariasis. And there is an approach to tackling lymphatic filariasis using 3 drugs: ivermectin, diethylcarbamazine, and albendazole. And the response in Papua New Guinea to this triple drug therapy is huge. It's a much stronger response than anywhere else in the world. So it was first tested in New Ireland, I think with support from the Bill and Melinda Gates Foundation. It was rolled out to East New Britain, and we've had one round in West New Britain. So an innovation, Jimmie, right? Triple drug therapy, ahead of the world, and showing a good response. PNG wants to take that one step further and add another drug to this, azithromycin. So 4 drugs cover 5 diseases. But there was no WHO guidance for this. It wasn't possible. And the drugs are donated, but they won't donate the drugs unless there's a WHO set of guidance to do this. So we heard about this last year at a meeting in Sydney. And WHO in record time, particularly with support and leadership from the regional office, has developed guidance. Now, based on all the research and work done in PNG, and it's approved, and the drugs will be donated. And so I'm really keen that in West New Britain this year, there is a rollout of co-administered drugs, 4 drugs, that will tackle 5 diseases. And I'd love to see that synchronized with bed net distribution, indoor residual spraying, and other malaria programming, just to see how integrated programmatic implementation is really strengthening a health system. I really want to call out, I don't know if Dr. Lucy John is in the office, but work that Dr. Lucy has done has changed global guidelines, has changed how the world is looking at this. And so PNG is at the cutting edge of demonstrating something that can work. So as we look at the malaria burden here, we look at you will not make progress across the Pacific unless Papua New Guinea does. I think those integration opportunities are really important. My final point would be to encourage governments to think about how one looks for those synergies, and also, Lady Ros, to think about how the Global Fund grant making can also incentivize and stimulate this. It's done it in the past. A Global Fund grant to Togo meant Togo eliminated LF. A Global Fund grant to Ethiopia helped Tedros create this incredible workforce. So it's an incredible power for good. But yes, you think about your mandate, the 3 diseases, but there are ways in which you can think about those diseases, but also help raise all boats by doing so. Thank you, Christoph.
Thanks so much, Simon. I thought that was a very powerful message. There are real opportunities for integration, for collaboration between different disease programs. It's also very encouraging to hear about progress in other diseases. Malaria can learn quite a bit from other diseases that have already been eradicated, or as you said, guinea worm, polio, and others, getting very, very close. So we should look at all of this together, if you like. All of these are very noble goals, and we will achieve those faster and better if we collaborate across the kind of disease sectors. So a very powerful message. Thanks for that, Simon. So now turning back to you, Jimmie, you already gave us your introduction, and you also mentioned at the beginning that you have really been engaged in also the Global Fund programs in the region from the very beginning. I remember that well, the multi-country grant that you helped to manage. So you have this perspective both over the last 2 decades, but also across the whole region. And we're talking about innovative finance mechanisms. There's also often talk about new funds maybe that could help complement, domestic funding could help the multilateral funds that we have, like the Global Fund and so on. Could you tell us a little bit more about, those plans and how that could, help advance our agenda? Thank you.
Is this working? Maybe I'll go with yours. This is the proven one, plus that one. I thought that was a nice benediction that we just closed after the last one. But look, thank you so much for that. And what you've heard is a lot of promise of good things to come. And I think for the Global Fund, one of the things, Global Fund itself is innovative, one of the very best examples of innovating finance mechanism that was put in place to address things that were actually killing a lot of people. So that is a very good example, and I think one of the lessons, having been on both sides of the equation in the region to help support countries, but in the country trying to benefit from regional programs financed internationally, there are issues on governance and fiduciary that I think are quite important for us to actually also look at. Creating funds, once it's supported, is easy. accessing funds is difficult, particularly for small island countries. And the rules that govern access are even more tricky for countries. And I think the Global Fund has gone through a process where you focus on management and then cash on delivery and now back on focus on management, the funds. I think that is good because in particularly small island countries, cash on delivery is designed to fail because the countries do not have the capacity. That is why they need the funds. But if they're required to bring front loading, that forces them to have another loan somewhere else. So it's actually a double burden for countries on modalities like that. So I think it's very important that we have a look. Debt swap, quite critical. Now, in the Pacific, in early 2000, there was a concept developed for Pacific Health Fund. And I was part of that group that actually looked at developing it. And the rationale for it, and I think that's very important before coming back here, why do we actually look to another kind of fund? And the reason is that many countries have a huge deficit that their national domestic financing will not be able to support. Secondly is because the global mechanisms are quite difficult for these countries to actually obtain the level of funding needed to make the difference. And bilateral support was also not very good because our bilateral partners would say we give money to the World Bank, to the Global Fund, to ADB, and therefore multilateral funding should be coming back to you, but it never does. Not in the amount that is needed to actually make a difference. And this is what drives ideas and concepts about, well, we do need to establish a new fund. Now, one of the discussions around Melanesia is the thought of establishing a concept for a Pacific integrated disease elimination fund. So it's not limited to one disease, it cuts across quite a number of diseases. I think exactly the example that we've heard on what works in Papua New Guinea, but stretches it further. The downside of that is development partners say, well, there's already many funds out there, and therefore, why do we need another one? Global Fund is already out there. Why do we need another fund? Global Fund has a mandate in 3 diseases. But to eliminate these 3 diseases in any of the countries, you need to extend beyond those 3 diseases. It's about health management. It's about the kind of cross-cutting measures we're looking at. And therefore, it's important that we start to think about these scenarios not as replacements to, but as complementary to existing financing mechanisms. So I think that's one of the concepts that is being looked at, and I'm pretty sure that in the next 6 months, the Melanesian part of this region will be looking to assess the pros and cons of that with the help of APOLMA, WHO, the Global Fund, and others to be able to look at that. Now, how do we finance such a fund? Some thoughts have already been shared with our partners, and some of them are actually quite keen to listen to see whether this is something that might work. But for the partners, for instance, they contribute to the Global Fund, but the countries do not, they feel, get enough of the Global Fund from the partners that are very close to us. And so how about if they contribute to the Global Fund, a small proportion of that for the Melanesian sub-region could be moved out so that we don't have to compete on the Global Fund level, but that this fund can actually operate like a Global Fund's branch of executing some of this in the region. So that's an idea that comes up on that. But I think when you look at Sandy's presentation, when we're looking at this, millionaires and billionaires and trillionaires coming up in the next little while, maybe what we also need to do is a strategy on how to make disciples of these trillionaires and billionaires. A lot of them are people with a good heart, and maybe it is our selling, it is the way that we market this to them. What is in it for them? I think that is more the area that we need to focus on. So innovation, not only in trying to mobilize funds, innovation in not only to integrate, innovation in not only linking all the countries, all the ministries in any country, but also innovation on messaging, so that the people with the resources can actually take a different view of this. They need to look at this not just from the billionaire's lens, they need to look at this at the lens of how can a billionaire actually promote the eradication of diseases that are killing people. Finally, on the private sector, I think the private sector is a very powerful mechanism. But in small island countries, we really need to demonstrate to them what is in it for the private sector. And the minister from the Solomons will probably share a little bit, he was from the private sector himself, that we need to do an assessment of lost days of work to that private sector and compute that into the financial resources they lost and the loss of productivity. And then we could say to them, look, you've lost X million dollars of lost productivity. You only need to contribute 30% of that and you'll help eradicate malaria. So I think, again, it comes back to messaging. And sometimes our messaging is more driven technically from our lens. We probably need to learn a little bit more on how to make disciples out there. So that's another innovation, making of disciples. But I'm speaking too much and like a priest now, so I better stop. Moderator, thank you.
Thanks so much, Jimmie. And I felt, in a sense, you indeed combined, some of the, messages we had from the previous presentations from Sandy, from Martina, and also Simon. You were proposing this Pacific Integrated Disease Elimination Fund, taking up what Simon you talked about the kind of need and the potential for integration. You talked about who can finance such a kind of regional fund. There is, of course, philanthropy, and not only global philanthropy, but there is a lot of wealth also in the regions that I think should be tapped and that can complement the contributions made by the government. So I think there's quite a bit of potential there, and I really hope we can jointly work on that, looking at Sarthak and the team from Appelmar, but certainly as a chair I would very much support that. So in a brief summary of what you've heard, I said I wanted you to go out from the session with a bit of a sense of hope that this can be done. We have a fantastic goal, eliminating malaria. It can be done. Many countries have already demonstrated that. We've seen that with other diseases. And we have new tools coming up, new vaccines, new methods, how we can really diagnose and treat and prevent malaria faster. So we opened the session with this huge challenge, but the resources are lacking, and you demonstrated the gaps, country by country. But I hope you come out of the session with a sense that, indeed, there are sources of funding. There are innovative ways of funding that ranges from, engaging philanthropy, development banks. We heard very innovative, ideas from the Ministry of Health here in Papua New Guinea, with the Health Promotion Fund, with special taxes that can be used, including also the private sector. If you make the case that they see the benefit, for their employees and for their communities in which they're operating in, including the extractive industries, that can be a source of funding. We heard about the potential for integration, leading to greater efficiencies, effectiveness of the programs, and the possibility of regional funds complementing global funds and other instruments. So I hope you've heard, lots of opportunities in innovative finance. I do know from my own experience that it's always a challenge to go from the idea to the actual implementation, but I'm confident that we have the capacity and the knowledge and the expertise here in the region to make that happen. So that's from me as a summary of our panel. Maybe back to you, Mr. Chair, to close us off before we go to the next session. Thank you.
Thank you. I think that was a very useful session, and it does give us a lot of hope that there is financing to be sourced. There's different levels of challenges in terms of identifying, mapping out what's available, what are the requirements, how do you integrate different interventions that achieve a greater outcome. And just to listen in on some of the key experiences that have come off the panelists is for me revealing in some ways, but also thinking in terms of some of our specific challenges, Papua New Guinea, for instance, where we probably just need to make sure that we understand what's out there and how do we map those different sources into integrated whole that would address a key outcome for all of us. Please join me in thanking the panelists, the moderator, in a very useful and informative session.